I have a question for you. If someone you cared about came to you with chronic digestive issues, sleep problems, and constant exhaustion, you'd immediately recognize this as stress-related symptoms requiring attention. You'd encourage them to set boundaries, practice self-care, seek professional support. So why is it that when you experience these exact same symptoms, you dismiss them as just a part of life? Your gut is paying attention to this double standard, and it's not happy about it, my friends. I had this mortifying realization a few years ago. I was sitting with a patient of mine who's describing their symptoms: the Sunday anxiety, the digestive issues that flared during stressful periods, the exhaustion that never seemed to fix, right, or resolve. As I listened, I was thinking about all the ways I could help them: nervous system regulation techniques, boundary setting strategies, the importance of processing emotions instead of suppressing them, all the right foods and lab work, all this stuff. Then it hit me like a truck. I was experiencing every single symptom they were describing. Like, talk about disassociation, right? The difference was I was calling it professional dedication when I did it, but recognizing it was burnout when they did it. I was living a complete double standard that was destroying my gut health while I helped others heal from theirs. That moment of recognition was both humbling and infuriating, frankly, because how could I be so blind to my own patterns while being crystal clear about what others needed? So if you're a helping professional, you probably experience what I like to call the compassion gap. That is the vast difference between how you treat others and how you treat yourself. You extend infinite patience to others' healing journeys while being harshly critical of your own struggles. You validate others' stress responses while dismissing your own as weakness. This isn't just an emotional or psychological issue. It creates real biochemical consequences. And your nervous system doesn't distinguish between criticism from others and criticism from yourself. And when you judge your own struggles, dismiss your needs, or demand perfection from yourself, your body responds as if you are under attack. That harsh internal dialogue you never use with someone you care about, it's triggering the same stress responses that external criticism would create. Your gut bacteria is suffering from the chronic cortisol elevation caused by your own self-judgment. Professional training often sets us up for this double standard. So we learn to focus outward while minimizing our own experiences. We develop expertise in recognizing other symptoms while becoming disconnected from our own internal signals. We are taught that our value comes from helping others, not from taking care of ourselves. Your professional identity might actually depend upon this imbalance. So if you acknowledge that you need the same support you provide others, would that make you a hypocrite? Would it threaten your credibility as a helper? These fears keep many professionals trapped in cycles of self-neglect that their gut health cannot sustain. But here's the truth. Your healing isn't separate from your ability to help others authentically. It's the foundation that makes genuine service possible. So when you model the self-care you recommend, that you give others permission to prioritize their own well-being without guilt. Your digestive system is exquisitely sensitive to the incongruence between what you know and what you do. And when you spend your days teaching others about stress management while ignoring your own stress signals, well, your gut processes this contradiction as a chronic low-level anxiety. Your second brain, that sophisticated network of nerve cells in your digestive system, is constantly monitoring for safety and authenticity. When your external actions don't match your internal wisdom, it creates a state of nervous system confusion that manifests as digestive dysfunction. Think about it. You probably know exactly what would help your digestive issues better boundaries around emotional labor, regular nervous system practices, processing emotions instead of stuffing them down, seeking support instead of carrying everything alone. Your gut is waiting for you to apply your own expertise to your own life. So let me ask you some questions, and I want you to answer them as if you were talking to someone you care about who had your exact symptoms. So first off, what would you tell someone who is experiencing chronic bloating and digestive issues during stressful periods of time? Well, you probably suggest that they look at their stress management practices, consider the gut-brain connection, maybe work with someone who understands trauma's impact on digestion. What would you say to someone who is absorbing everyone else's emotional weight while neglecting their own needs? Well, you'd encourage boundaries, self-compassion, and recognizing that their sensitivity is a gift that needs protection. What advice would you give someone whose Sunday evenings were filled with dread about their Monday mornings? Well, you'd help them see the patterns, suggest nervous system regulation techniques, and remind them that anticipatory anxiety is optional. The wisdom you need is already there. The question is, are you willing to receive it from yourself? There are deep psychological reasons why applying our own advice feels so darn challenging. And many helping professionals learned early in life that their value came from taking care of others' needs while minimizing their own. Self-care can feel selfish when your identity is built around service. Professional training reinforces this pattern by teaching us to override our personal needs in service of others. We learn to power through our body's signals, push past our emotional limits, and maintain professional boundaries while neglecting personal ones. But here's what I've learned. The same sensitivity that allows you to help others heal is also your body's way of communicating its own needs. Your fatigue isn't character weakness, it's information. Your digestive issues aren't random. They're your system's way of saying it needs attention. Closing this compassion gap requires conscious, intentional practice. You can start by using the same gentle tone with yourself that you use with others. So when you notice self-criticism, pause and ask, would I say this to someone I care about? Apply your clinical recommendations to your own symptoms. So if you'd suggest nervous system regulation for someone with your digestive issues, try it for yourself. If you'd recommend therapy or coaching for someone processing secondary trauma, consider your own need for support. Schedule self-care with the same commitment you show professional appointments. Your healing deserves the same priority you give to others' recovery. This isn't selfish, it's sustainable. The most radical thing you can do might be treating yourself with the same compassion you offer everyone else. Your nervous system is waiting for this consistency. Your gut health literally depends upon it. And when you start applying your own wisdom to your own life, something beautiful starts to happen. You stop feeling like a fraud who's helping others while falling apart personally. Your authenticity increases because you're living aligned with what you know to be true. I've walked this walk. Others notice this shift too. So when you model the self-care you recommend, you give implicit permission for others to prioritize their own well-being. Your healing journey becomes a part of your healing offering to the world. And this week, I want you to try an experiment. When you notice any physical symptoms like fatigue, digestive issues, sleep problems, anxiety, ask yourself, what would I tell someone else who's experiencing this? And try following your own advice. Keep it simple. Notice the resistance that might even come up. Pay attention to the reasons your mind gives you for why your own symptoms don't deserve the same attention you would give others. This awareness is the first step in closing that compassion gap. The advice you give others isn't just professional wisdom. It's wisdom your own body needs to hear. Your gut has been waiting for you to extend the same compassion inward that you so freely offer outward. And you don't have to choose between being an effective helper and having your own needs met. In fact, the more you honor your own wisdom, the more authentic and sustainable your service actually becomes. So what's one piece of advice you would give others that you need to start following yourself? Share that in the comments. Let's support each other in closing this compassion gap. And if this resonated with you, subscribe, like, share, comment, review, all the good stuff, because we're continuing to explore this intersection of professional, helping, and personal healing. Your body isn't asking for perfection, just consistency between what you know and what you do.